time for our very informative weekly Healthy Living segment. Dr. James Hawley of Southeast Texas Medical Associates joining us now. Thank you for being here.
Thank you.
Dr. Hawley, what is the SETMA Model of Care? If you really, I guess, elaborate on what exactly it takes to care for everyone that comes into the office.
We're smiling if my cell phone just went off. Whoever that is, I'll call you in a little bit. A model of care is really the content, the structure, and the focus of care. And there are about 300 models of care identified in the medical literature. About 4 years ago, we defined the SETMA Model of Care, and it really has 5 elements. Very quickly, one is that we track every patient, every day, every time, on over 250 quality metrics to make certain that we're giving them excellent care. Secondly, we audit that by populations and by providers to see if over a large group we're doing that as well as we do on an individual. Thirdly, we analyze that with statistical probability to see if there's a large group of patients that aren't getting care, but it's obscured because so many are getting good care. So we want to know that everybody's getting care. And then fourthly, we publicly report that so that our patients can look on the web and see how their provider is doing. And we also give the patient every day their quality metrics. And finally, we design quality improvement initiatives based on those 4 measurements to make sure that we're constantly working to improve care.
And improving the care, that helps each individual patient because their care will vary from each person.
Absolutely. You know, you need some way of comparing things. You can go out to a car lot and kick the tires, so to speak, and know whether one car is better than another.
Check it out.
But how do you know whether a healthcare provider is doing the things that ought to be done? But you really don't, and you can't really go by personality. Somebody may be very excellent as a physician and just not have a good bedside manner, but they'd be doing a better job than someone else. This way it gives you an objective measure to determine whether you're getting the kind of care you should have.
I can see where that's very beneficial. Is this something that you find is done in the majority of offices around America?
It is not presently, but it is now possible with electronics, and it's going to become the standard of care as we move in further in the 21st century. It is a new model of care. It is it's exciting. It's really fun. We have monthly meetings. In fact, tomorrow morning from 9 to 12, all of SETMA providers are going to be together. We're going to be going over quality metrics, seeing how everyone's doing. If a person's not doing as well as they ought to do, that's okay, but we want them to improve. I've never been ashamed that I'm not doing what I ought to be doing. I'm only ashamed if I'm not willing to improve. And so constant improvement, constant analysis, constant review of performance is the standard that we've established, and it really works out well. And it's really fun. I tell the young doctors at SETMA, when they get older and mature, they'll be able to do as well as some of us older guys do. And they smile and laugh, and but anyway.
And it sounds like really in Beaumont, it's hard to know. We hear so many negative things about healthcare and being concerned about it. But in Beaumont, we're really trying to focus on people at home.
SETMA, Southeast Texas has a lot of excellent physicians. You really just have to go back to Hurricane Irene. My mother's name is Irene, by the way. You just have to go back to Rita and see how this medical community responded to the crisis. A lot of doctors stayed at their own peril, took care of folks without regard to whether they could pay. I was very proud of all the doctors in Southeast Texas. We have an excellent medical community here, and they're all growing. We're all learning a new methodology of healthcare, a new electronic system of patient care that's really improving the quality of care all over. So we can be very proud of our system here.
And moving with the times.
Absolutely.
Well, thank you. We appreciate it as always, and
Thank
we
you.
appreciate this. And we'll have it on our website as well too, and on SETMA if you can go and find that information there.
Delighted to be here.
Well, we're